Hi, my name is Stephanie LaRoe. I'm an associate professor of emergency medicine at Carilion Clinic in Roanoke, Virginia, and a member of the WMS DiMM faculty. Chronic medical conditions is not something that gets many people excited. However, it's something that's very important when considering working in austere environments, as many Americans suffer from chronic medical conditions. First, what is a chronic disease? The CDC defines chronic diseases as conditions lasting 1 year or more that require ongoing medical attention or limit activities of daily living, or both. Typical chronic diseases you might think about are heart disease, cancer, and diabetes. These are the leading causes of death and disability in the United States, and they're also the leading drivers of the nation's $3.5 trillion in annual healthcare costs. What are some other chronic conditions? Substance abuse, whether it be alcohol or illicit substances, Alzheimer's disease and related dementia, heart failure, arthritis, hepatitis, asthma, HIV/AIDS, atrial fibrillation, hyperlipidemia, autism spectrum, hypertension, cardiac ischemia, chronic kidney disease, osteoporosis, COPD, psychiatric disorders, stroke, diabetes, are just a few conditions that can be considered chronic conditions. Chronic conditions are really important to know about because they are very prevalent within our society. In fact, about 6 out of 10 Americans have one chronic disease. 4 out of 10 Americans have 2 or more chronic diseases. About a greater than 30 million people have diabetes. About 1 in 3 people have prediabetes. About 3 million people have epilepsy. About 500,000 of those are children. And about 1 out of 3 deaths are attributable to stroke or heart disease. So when you look at this picture, this may strike you as someone who shouldn't be in the wilderness or would require a lot of considerations before going into the wilderness. This patient likely has some heart disease, probably diabetes, and clearly morbid obesity. If someone had described this patient as a diabetic going into the wilderness without more information, you may not come to this picture. You could also describe this patient as a diabetic in the wilderness. You can imagine the medical concerns between these two patients, although they both share the same disease process, is vastly different. So, would you take this person into the woods? A 50-year-old male, history of diabetes on insulin, well-controlled hypertension, obese. I'd venture to say many of you would want a lot more information about the patient before you made a decision about whether they were appropriate to go on a trip. And you would figure that it really depends on what kind of activity you're doing. If you're going down the lazy river at an amusement park, most people might be perfectly fine with this activity. However, if you're going on a class 5 rafting trip, you may really need to reconsider which participants have chronic medical conditions that may make this difficult, dangerous for themselves, or dangerous for the party. One way of looking at this objectively is to classify the activity that you're doing on the 1 through 4 grading scale. These would be extreme performance adventures, so this is high altitude mountaineering, Himalayan trekking. High performance ventures, which would be more of remote hunting, perhaps trekking at high altitude, maybe jungle trekking. Your class 3 would be more of recreational activities. This is kind of what your weekend warrior does. This may be just trail walking, alpine hiking, taking a hike in a national forest, forest-based orienteering. And then in class 4, there's actually therapeutic activities. And these are activities that are specifically designed for people with a chronic disease, such as like cardiac rehab, or other activities that are designed for people with chronic medical conditions. In addition, when you're screening someone, you want to think about what their typical health is and level of activity. When you describe a 50-year-old male with diabetes and obesity, these are 2 very different patients. It's very important to know what their normal functional status is. When preparing, it's also really important to screen your participants. You want to build your medical kit based on your participants and the expected problems and location of your trip. And you want to buff up your knowledge about conditions that people going on your trip may have or may be more likely to have. Preparation is really key in preventing a bad experience. So now that we've characterized the activity that we're going to do and we've thought a little bit about our participant, we can actually grade our participant. We can grade them into 5 groups. Group A is your athlete or athlete in training. These are people that have demonstrated ability to engage in high performance activities, and they are training and have a high level of physical fitness. Your group B would be your healthy, vigorous individuals. These are athletes, active hunting guides, people that remain very active in their daily lives, however, maybe not under the stresses that Group A would be under. Group C is your healthy, deconditioned individuals. A lot of people fall into this category. This is the young to middle-aged, healthy business and professional people who are moderately active. This may be more of your weekend warrior sort of person who perhaps at one point fell into Group A or Group B, but because of a lot of stresses in their life have become a little bit deconditioned. You can also classify people into Group D, and these are individuals with risk factors. Their risk factors may be due to age, lifestyle, alcohol consumption, or other factors not in their control. As people become older, most fall into this group. And then your Group E is typically pretty obvious. These are individuals who are actually manifesting illness. These are people with chronic illness and physical limitations. They may have heart disease, diabetes, neuromuscular, or orthopedic problems that impact their function. So why do a pre-trip screening, and what do you want to find out? You really want to find out somebody's full medical history in order to understand problems that they face and they may face. It's also important to know their prior trip history. If a type 1 diabetic has successfully summited 6 out of the 7 summits, your thought process may be very different when they want to go on a high altitude trip than a diabetic who has never been to altitude before. So very important to understand what their prior history is and their prior level of function so you can make appropriate recommendations for trips. Medications and allergies are really important. A lot of times people won't list all of these. Very important to have a good list of this. Make sure that the patient knows medications that they should take extra medications with them, and think about the environmental influences on any medications that may degrade over time with heat or that may freeze. And then finally, current fitness. And this needs to really be assessed close to the beginning of a trip because busy people's fitness can wax and wane rapidly. So some sort of assessment of current fitness is really important. This may be difficult because sometimes people's perception of their physical fitness and their actual physical fitness can differ. So finally, in order to evaluate, what you do is you take your activity, groups 1 through 4, and you take your participants, group A through E, and you can see the category of components: personal data, historical data, medical findings, physiologic assessment, and psychological assessment. And you can see the recommendations. So for example, somebody who has severe illness or debility perhaps should not participate in activities that are of the 1 or 2 level. You can see someone who's healthy and deconditioned may really just need to know, you may just need to know about their historical data and physiologic assessment prior to them participating in a level 3 activity. This figure is to help guide you determine what sort of examination or what sort of information needs to be gathered based on the activity and the person that is participating. And here's a little bit more information about the components of the medical examination as listed on the prior sheet. You can see that personal characteristics are just age, gender, education, travel history, some social history such as drugs, alcohol, steroids, and then any psychological or personal problems during wilderness ventures, athletic participation. Historical features will be more about illness, with emphasis on cardiovascular, pulmonary, musculoskeletal, and neurological problems. Medical examination would include a basic physical exam, especially paying attention to blood pressure, cardiac and cardiovascular systems. And physiologic examination is typically not required. It depends more on the venture and may include functional aerobic testing with VO2 max, or functional testing with EKG monitoring, if there's concern for cardiovascular disease. If somebody's going to altitude, testing hypoxic ventilatory response could be considered in certain situations. And then finally, psychological interviews are important to try to discover any kind of history of previous difficulties. And these should probably be thought of more for long treks or experiences that may be incredibly stressful or have different levels of stress than a normal outing. And finally, when considering whether somebody should go on a trip, you need to consider the distance or time to what I show here is a hospital, but this would be definitive care. It may be very different to have someone on blood thinners climbing at a crag that is roadside and 5 minutes from the hospital, as opposed to having someone on blood thinners climbing on a crag that is days or an 8-mile hike to a remote road with a several-hour drive to a hospital. So this is going to kind of change some of your risk tolerance based on the accessibility of the area where you are. So through our organization DiMM Adventures, we would like you to explore some of these chronic medical conditions through this interactive web module. And when the goal is to determine a validation code below for each of the topics. These codes are sort of hidden through the material to ensure that you spend some time with all the material. They're not always obvious, but you may find them, you'll find one on each tab that corresponds to one of the questions. By answering the quizzes, watching the video material, and reading the articles, you'll be able to find the answers to these validation codes. If you don't have time to sit down and do this entire module at once, you can do it in sections. Just write down the codes and you can enter them all when you're finished. You have to get each code right in order to be able to unlock the personal health information for the participants on some of our trips. It should take you approximately 2 or 3 hours to completely work through this module. We felt like this would be more interactive than listening to a 2 or 3 hour PowerPoint lecture. So please bear with us and check out all the tabs. You can also access this site later on as a resource when you're working with participants. Most of the information is provided on all the tabs. You should also consider using your mountain medicine textbook as a resource with the assigned chapters. If you have any questions, please reach out. My contact information is on the main sheet, the main page, and I'll be happy to help you with any questions that you have as you work through these tasks. Thanks, and enjoy.